I think we all learned a bunch of lessons during the pandemic. I learned some tricks too. I'm now semi-competent with Zoom. Glad we're in person today. So today's discussion will provide a snapshot of where we've been in the health space the last 2 years, but more importantly, where we are with our new normal. We've learned lessons about working together in a different way through greater regional collaborations, what local health systems and health providers need to meet workforce, housing needs, and how our region can come together to help. So our intent in this panel is not to dwell on the pandemic and the negative, but to uplift the good partnerships that came together during the pandemic, and now we need to sustain them. So to achieve true economic recovery, we need to take a moment to acknowledge the reality of the past 2 years, and then pivot to what we need to help our various sectors succeed while centered and more aware of the structures required to integrate greater diversity, equity, inclusion, and access in our Tri-County region. I am so pleased to be joined today by this distinguished panel. And so to kick us off, panelists, would you please introduce yourself, your institution, and what area you serve in the region? So Pete, we'll start with you.
This is on. Okay. Yes, my name is Pete Delgado, and I have the privilege of being the president and CEO of Salinas Valley Memorial Healthcare System. We provide our major services around Salinas area, South County, North Salina, but very quickly we're becoming a regional resource for the specialty services outside our county.
Does it?
It's okay.
It's on now? Okay. Yeah. So I'm Rosa Vivian Fernandez Vadillo, and I represent San Benito Health Foundation. Our organization was founded in 1975 by farm workers as a community health center, and in 2007 became a federally qualified health center, and we're both a farm worker and a community health center funded from HRSA. And we serve the San Benito and surrounding areas. We have clients that come from San Benito County, they come from Los Baños, Santa Cruz, and Monterey County.
Morning. There we go, wake it up. I'm DeAndre James. Thanks for letting me put on pants today. I am the Executive Director of the Community Health Trust of Pajaro Valley. Pajaro Valley includes San Benito County, Santa Cruz County, and Monterey County. We are based out of Watsonville, California. If you've not seen our name, we've been highly involved with Watsonville Community Hospital, but we are a provider, funder, and advocate for the health and well-being, especially for those in the underserved communities.
So thank you for that. Our health systems were certainly taxed in the pandemic in a way that was unprecedented, that we really hadn't experienced before. So what now is the biggest challenge you face with your institution in helping to serve the needs of our region? So Rose Vivian, maybe we'll start with you.
It woke up. Okay, so we represent about 13,000 community health centers throughout California and over 18,000 community health centers throughout the nation. And in terms of the biggest challenges, as everyone knows, we actually were greatly affected because our population is mostly individuals of color, and for our community is a Hispanic community. And so in terms of, we pivoted, we bent over backwards in every which way we could to service the community. And as we move forward, this is not over, folks, and we have other challenges. So we continue to pivot and look at what lays ahead and respond to the needs of the community and also to our obligation to the federal government. The greatest challenge is right now workforce and workforce housing. And something to note is that the pandemic, Dr. Dawn Troidel, one of our colleagues that sadly passed away during the pandemic, he said, we're not going to see the impact of this until 2 years from now. But we're seeing the impact now in terms of the educational opportunities that some of our community members received and how they were ill-prepared to continue higher education, and we are now interviewing and hiring those individuals. So how do we embrace that change while meeting the needs of skills and service delivery?
For us, I think that's amazing, actually amazing work. It's continuing, I like to call it BC, DC, and AC, right? Before COVID, during COVID, and after COVID. That's how we typically talk when we talk to everybody. And so what did we learn about ourselves before COVID? What did we learn about what we need, what we don't see, what we do see? What did we learn during COVID, DC? And then what are we gonna do after COVID? And so as we work ourselves to after COVID is how do we don't go backwards? Let's not go back to what we were before. We learned something, we went to it, it was traumatic, it was that. What did we learn? How did we grow? How did we do? And so our point is, how do we continue to focus on these inequities? How do we continue to make racism and how, in this great speech that we had today, how do we continue that work? How do we continue to be in these different places and different things? How do we support all these nonprofits in these communities that's been doing this work for decades and years and make their work the forefront of really, instead of the back burner of what we've been doing? How do we continue to do those things and keep those conversations alive? And so we've been working with how do we, together, right? And I think the great word that he used today was how do we go from the to our and to we and to us, and how do we continue to do that? And so that message is what we continue to do. My own personal mission, I think, is, as a leader in this community, is just to open doors for opportunities and continue to open doors for opportunities for those who don't have it. And so how do we kick open doors? Because we started to crack them during COVID. We started to mess with them around COVID. And so now as we work ourselves after COVID, how do we continue to kick those doors? And I think that's where the struggle is, to not go backwards and say, oh, we used to do this and let's just go back to doing that. No, let's not go back. Let's not go back, because that would put us in the position we were in. Let's go forward and take the lessons we learned and apply them daily.
Well, I like the way DeAndre organizes this communication, because it's before, during, and after is really what we've all learned. Before the COVID, we were a very collaborative. We worked well with the other hospitals and so forth. During COVID, besides circling the wagons and going outside the four walls of the hospital in the community, we worked much more closer with our hospital colleagues. There was a supply chain issue big time in healthcare. We weren't, this is a new virus. We didn't have the medications. We didn't have the protective equipment that we needed. We scrambled. We shared resources. We communicated every day, sometimes twice a day. And out of all that, we are a better organization. We've learned how to share resources. We learned to communicate throughout the community. We are a very good repair shop at the hospital, but we're a better community focus. We've during the pandemic, we sent out about 200 employees out in the community for the Salvation Army. Our nurses went out to the fields to educate the farm workers to stay safe and how to keep their families safe early in the mornings. The food bank. So we did a lot of that. So we got a very good community feedback about what we were doing, especially our employees who at that time didn't have any work because we stopped the elective surgeries, and we had a chance to continue their employment. And today we're a better organization. We learned how to deal with challenges together as a community healthcare center. And so we're planning more things together, like diabetes, for example. We all agreed that diabetes was a community issue. We went after it with a vengeance. We created a comprehensive health center and just focused on diabetes. And we made sure the medical community had the resources and the education to use best practices. And so that was an example of all the hospitals coming together in the medical community.
Yeah, that collaboration really was important. I remember at UC Santa Cruz, we were trying to learn how to do testing, right? So testing was, in addition to the PPE, was an important thing that helped us get a handle on the pandemic. And I know your organizations were really helpful with that too. And I was thinking about that really powerful keynote presentation that we had from Chris Benner and Manuel Pastor, and highlighting inequities. And we see inequities certainly in the healthcare. And so I wonder, how your institutions are working now to help us address those inequities, especially with what we know now after the pandemic. DeAndre, do you want to start us?
Yeah, that's a great segue. During the pandemic, there were multiple groups that I got a fortune to be a part of, and I think as Pete mentioned, everybody kind of gathered and started circling the wagons like, hey, we can't be in our silos anymore. We can't be just doing our things anymore. We have to come together, we have to talk, we have to do these different things. And so I was fortunate to be, and I might miss some of the names of Save Lives Santa Cruz, it was South County, Community, or South County COVID Coalition. I mean, you name it, all those different groups, but it had a lot of different people in there talking about how do we go forward. And so what we have decided to do is support that conversation to continue. And so we have worked with and partnered with other organizations to because you need resources and finances, right? You need resources to that. So we have took some of our own, as well as meshed with other organizations to put resources to continue that conversation around having consultants and other people who do this work and who have done this work in other communities to come here and teach us and learn so we can learn and continue those conversations and continue to break down those walls of inequities. So we're working to continue those conversations and bring that stuff to the forefront.
Well, our organization, the premise and the mission of our organization is to address the inequities and make sure that everyone has an equal start and that no one gets left behind. In terms of moving forward, we continue to partner with local organizations and also state and national organizations to bring resources to the community and ensure that our patients are seen, or our community is seen. And the big issue for us is that we had essential workers in our patient population, the farm workers, the grocery workers, those individuals with whom, if they were absent, others could not survive and stay at home and get their groceries at their door and get food delivered, and they were invisible. Because you could get the toilet paper, and I laugh because the toilet paper became an issue, but you get the toilet paper because someone put it in that store for you to purchase. So you look at continuing to ensure that our community is visible, that we see them, and that everyone sees the importance that they bring to the economy, because it is our economy and our community is diverse, and it brings people from all levels of contribution, including the farm workers and the janitorial services and the grocery store workers. And so it's really important to keep that in mind and continue the visibility of the community, ensure that they have the ability to have dignified housing, dignified services, and are at the forefront if we ever have another emergency like this again.
Rosalie, you guys do a great job over there in your service area. What we recognized, and very quickly, a few years ago, that access to health care was the #1 community health need. I've been working in places, in Texas and here. I've never seen a community health need to be access, #1. I've seen cardiovascular, oncology services, but not access. So, just like we went after diabetes with interventions with our colleagues in our community, we we went and started recruiting. We went from 4 doctors to 160 doctors, 20,000 patient visits to 550,000 patient visits, and we have a payer blind policy, meaning we take anybody who needs specialty care and so forth. So I'm real proud of my network of providers that we've been able to improve and open the doors. In that process, we've identified pockets in our community where it's very underserved. I don't know what the community's concerned about immigration, but they just don't have access to primary care. So with the help of our foundation, we were able to fund a mobile healthcare clinic. And we're taking those clinics in those underserved pockets that we have. There's more need out there than we have supply, but we at least are making an attempt to try to bring healthcare to the underserved areas.
Yeah, that's really great to hear, Pete. And I think that that sort of highlights an additional thing that we have to think about. You talked about access. One component of access is getting the healthcare out to the people who might be reluctant to come into the hospital. Another component of access is having enough on the supply side. And the supply side is really workforce dependent. So can you talk about what your institution and the other institutions, we can hear from the other panelists, what are we doing to address workforce issues? Rose Vivian, you touched at this a little bit about trying to recruit new people in who have had healthcare education or training during the pandemic. How are we addressing that?
Well, there is a national shortage in healthcare workers, specifically nurses, and that has created a big gap and a big challenge to many healthcare organizations. Sometimes organizations have to close down services because they don't have the providers, the nursing, the technicians. We've been very fortunate. Now, we do have shortages. We have to complement our staffing with travelers. Well, we used to have 100. Now we've got about 40, 45 travelers. It's very expensive doing that. Long term, we want to create a pipeline of professionals. It's amazing. We start with middle-aged elementary kids. We bring them in and we introduce them, and then the 10, 12-year-olds come in to talk about healthcare. And then high school. We have a summer program, about 35 students for about 5 weeks. We actually pay them to do 2 projects. These are kids that they made up their mind, or they're almost made up their mind to pursue healthcare. And we pair them up with either a doctor, nurse, or none of them paired up with me. I don't know why. But they're all looking for a profession that they like, and we try to help them. And they get a great experience. And then recently we have this talent program that we bring students that are interested in healthcare to get some a rotation at the hospital to learn more about what they want to do. And it's important that we create our own pipeline, because if we can get our kids interested in healthcare, most of the time they go and get their degree, if not here, somewhere else, but they seem to come back. When I recruit mostly from the outside, because the shortage of expertise, there's a high probability they go back, then we lose them. There's a high turnover. So that's what our effort is, long term, try to create a pipeline to produce our own professionals.
So we would, prior to the pandemic, we would host a variety of students, mostly medical assistants, dental assistants, and some nursing students that were completing their rotation. And during the pandemic, we were thrust into the teaching environment because we had some students that could not complete their rotations at other sites because of their challenges, in particularly hospitals and urgent care centers that needed to cocoon with their expert staff and didn't have the ability to teach. So we actually started taking these students because we want to make sure that they graduated. And that posed a challenge for us, but also an opportunity. And although in our strategic plan we talked about having a teaching institution in the future, that this brought us forward into that planning process, and we're in the process of planning a teaching institution in one of our communities and building a new facility that would focus on that experiential component of teaching in partnership with the local community colleges, the CSU, and the UC system. I'm a UC brat twice over. I'm an Aggie Cal Bear, so woohoo. That partnership with UC is really important to us. In addition to that, we have a wonderful program, AB 1045, that brings 30 physicians from Mexico. These are highly qualified physicians that are teaching in various institutions throughout Mexico. And we had been in the planning process for about 20 years, and we had selected the candidates in 2016, but we couldn't bring that, it didn't seem to start. So we contemplated, we're in the pandemic, and our board was wise and said, let's move it forward. And so we brought in 2 of the physicians in the time that we most needed them, which was early 2021, and they helped bring their perspective of how they managed the pandemic in Mexico and springboarded a process of service delivery for our patients. And the California Medical Board was very supportive and helped us. I have to shout out to Clínicas del Valle Salinas, which was the spearhead institution that began this process 20 plus years ago. So we have a partnership locally. We have a partnership with A.T. Stills, with Touro University, and also a binational partnership with UNAM with these 30 physicians, and we hope to bring in 30 dentists and continue that exchange process. They will be here for 3 years, and then hopefully we get another 30 in our region. And so we're looking at different creative ways to look at workforce to the future. And in our teaching purposes, we would love for them to stay with our institution, but we realize we're a small institution. It might not be that attractive long-term. But if we can instill a sense of community, a sense of a patient-centered health home, and looking at the patient as a human being with their family members and not just a medical diagnosis, that we have achieved something, and maybe they go and contribute at other communities. So we continue our efforts to like Pete said, the pipeline, and we're partnering, remember, the homegrown scholars with A.T. Stills, which is a new program that comes out of Santa Maria. And we're hoping to have those scholars early 2023, their physician assistant students that will be doing their practicum in our community. And at times, it's that pipeline that brings people to experience the different professions and elect other professions. We've had health educators that have gone to medical school. We have had health educators that have gone to physician assistant schools. We've had medical assistants that have gone into nursing programs. So we want to provide the opportunity to hands-on training and also an experience for advanced education and an advanced contribution to society. And one more thing, I have to say this because our board, I have 2 board members, Vicky Montoya and Arcadio Viveros with us, but our board retired the minimum wage several years ago. And during the pandemic, conducted another salary survey, and we don't start people at below $21 an hour. And we're going to relook at the salary survey again. And that's really important to look at, that it's not just the salary, the minimum wage that is there because of the law, that we look at the realities in our community and who we have employed with us to ensure that they have optimal capacity to have a good life with their families in our community.
Rosa reminded me that of our partnerships with Hartnell, CSUMB, we have workforce planning sessions. We think far ahead. What are my needs? And so I am very pleased that the CSUMB and Hartnell are willing to ask us, the providers, what are the needs that we can anticipate. So.
Well, Cindy, I don't have to talk to you about investing in education, seeing you're the chancellor. So, but that's what we do. I think half of my employees actually graduated from CSUMB. So we have an intern program that we constantly do. But we also, we are the scholarships for those in health professions that leave all of PVUSD school district high schools. So we provide every year multiple scholarships to go into all the health professions in tech world. We also partner with Cabrillo College to provide scholarships there to actually keep kids in school when they're in school, and we also provide emergency funding for that. So we do a lot of scholarship work and a lot of donations and things like that to keep kids educated in school, to invest in it, because our belief is that, you know, being in a small town in a small region, and I came from that area, is only one or two ways that you get talent. You either buy it or you grow it. And so the best way to do is to grow it. Invest in your own people, invest in that stuff. So we try to invest in the kids in the community to get them educated and into health professions.
Yeah, I really like the strategy that you all articulated, not just of growing our own healthcare workers who will stay in our region, but providing them that economic mobility through those jobs that will really help to reduce the inequities in our economy. And so I think that's very exciting. So we have about 3 minutes left. So can you each take 1 minute and say what are the one or two things you want the audience to know or take action when they leave today? So Pete, we'll start with you.
I just want to remind folks in this community how lucky we are to have the world-class docs in our backyard. We've got some great hospitals, great physicians. We've recruited a number in our community. We are very fortunate to have access to such talent in our community. I also want to remind everyone that, you know, Montage and us, we've invested in a local health plan, a Medicare Advantage product, and a commercial product, an affordable Medicare Advantage and a commercial, homegrown here by our hospitals and by our medical community. So your premiums won't be going to Nashville or Chicago or San Francisco. It is here, and it's something we should be all proud of.
Thank you. Rosa Vivian.
So yes, we are very fortunate also with our teaching institutions. And though we've had transitions, we have a great opportunity to partner and have a robust education system that includes everyone. But I also wanted to give a shout out. We're very fortunate that we also have engaged elected officials. I see that Congressman Panetta is here. Early in the pandemic, I got a call and I couldn't figure out what the phone number was. And it was Congressman Panetta asking, how are you doing and what do you need? And that you don't see everywhere. So we have an incredible support and advocacy from Congressman Panetta at the federal level. We have representatives at the state level and at the local level. So we're very, very fortunate. And I would say continue to support, continue to ring their ears in order to ensure that our community is well served.
If you wouldn't mind indulging me, I know one thing that happened, and I want all of us to stand up real quick if we wouldn't mind. And so I would be remiss if I didn't say $65 million is what you can do when we come together. If I'm not up here because of that, that's a great reason Watsonville Community House is here. But the one thing I want to do is make sure we all take a second and close our eyes. And imagine this space, imagine this place, imagine this world where we don't have these inequities, where we don't have to have these conversations, where we don't have to do these things that we have to do. You see it? You got it? Now open your eyes, because that's what we all need to go get.
Thank you, panel. What a great job. I really appreciate your time today.